Preparing hearts. Trauma-informed care. Training guidance for our team. Creating a trauma-informed care training for the Andromeda team is essential for working with survivors of human trafficking or any other abuse. This training guidance is meant for all humanitarian projects. Encounters with survivors of crime are unavoidable, making it crucial for every team of professionals to be equipped with the skills and knowledge needed to effectively engage with and support survivors within their respective services. Introduction to trauma-informed care. Define trauma and its impact on individuals. Emphasize the prevalence of trauma among survivors of human trafficking or any other abuse. Highlight the importance of creating a safe and supportive environment. Definition of trauma. Trauma refers to any experience or event that overwhelms an individual's ability to cope. It can be a single incident or a series of events that leave a lasting impact on a person's mental, emotional, and physical well-being. Examples include physical or sexual abuse, neglect, violence, or any life-threatening situation. Impact of trauma on individuals. Explore the potential long-term effects of trauma on mental health, such as anxiety, depression, and post-traumatic stress disorder, PTSD. Highlight the impact on emotional regulation, relationships, and overall quality of life. Discuss the concept of trauma-informed care as a proactive and compassionate response to these effects. Prevalence of trauma among survivors of human trafficking. Share statistics and research findings that underscore the widespread trauma experienced by survivors of human trafficking. Discuss the intersectionality of trauma, considering factors such as age, gender, socioeconomic status, and cultural background. Illustrate the complex layers of trauma resulting from exploitation, coercion, and violence in trafficking situations. Importance of creating a safe and supportive environment. Stress the vulnerability of survivors and the significance of feeling safe in seeking assistance. Explain that a trauma-informed approach prioritizes creating an environment free from re-traumatization. Discuss the concept of felt safety and how it extends beyond physical safety to include emotional and psychological safety. Building trust and rapport. Discuss the impact of trust on survivors' willingness to engage with support services. Provide strategies for team members to build trust, such as consistency, transparency, and respecting boundaries. Address potential challenges in building trust with survivors who may have experienced betrayal or exploitation. Practical strategies for creating a trauma-informed environment. Provide guidelines for creating physical spaces that promote a sense of safety and empowerment. Discuss the importance of language choices, avoiding re-traumatizing language and promoting empowerment. Introduce trauma-informed policies and procedures that prioritize survivor well-being. Remember to incorporate real-life examples, case studies, and interactive discussions to enhance understanding and application of the concepts introduced in the training. Additionally, encourage team members to share their insights and experiences to foster a collaborative learning environment. Understanding the impact of human trafficking. Provide an overview of human trafficking and its various forms. Explore the physical, emotional, and psychological effects of trafficking on survivors. Overview of human trafficking and its various forms. Define human trafficking as the illegal trade of people through force, fraud, or coercion for the purposes of forced labor or commercial sexual exploitation. Highlight different forms of trafficking, including child/sex/labor trafficking, slavery, and exploitation. Provide global and local context, emphasizing that human trafficking is a pervasive issue with diverse manifestations. Intersectionality and vulnerabilities. Discuss how factors such as poverty, gender, migration, and discrimination increase susceptibility to trafficking. Highlight the diverse backgrounds of survivors and the need for culturally sensitive and individualized support. Physical effects of trafficking on survivors. Discuss physical injuries resulting from violence and exploitation. Explore the impact on survivors' health, including sexually transmitted infections, malnutrition, and substance abuse. Emotional and psychological effects. Explore the prevalence of mental health issues among survivors, including anxiety, depression, PTSD, and complex trauma. Discuss the challenges of trust, self-esteem, and forming healthy relationships post-trafficking. Trauma bonds and coping mechanisms. Introduce the concept of trauma bonds and how survivors may form connections with their traffickers as a survival strategy. Discuss coping mechanisms survivors may develop, such as dissociation or substance use, and the importance of understanding these as survival strategies. Impact on identity and self-concept. Explore how trafficking can erode survivors' sense of self and identity. Discuss the process of rebuilding self-esteem and supporting survivors in rediscovering their strengths and aspirations. Key principles of trauma-informed care. Safety. Prioritize physical and emotional safety for both survivors and staff. Trustworthiness. Build trust and maintain transparency in all interactions. Choice. Empower survivors by providing choices and respecting their autonomy. Collaboration. Foster collaboration among team members and with external partners. Prioritize physical and emotional safety. Define safety in a holistic sense, including physical, emotional, and psychological safety. Discuss the role of physical safety measures in creating secure spaces for survivors. Highlight the significance of emotional safety, emphasizing respectful communication, non-judgmental attitudes, and the avoidance of re-traumatization. Provide examples of trauma-informed physical settings, such as well-lit spaces, clear signage, and comfortable waiting areas. Build trust and maintain transparency. Explore the impact of trust on survivors' willingness to engage with support services. Discuss the importance of consistent and transparent communication in building trust. Provide strategies for team members to demonstrate trustworthiness, including setting clear expectations, being reliable, and communicating openly about limitations. Empower survivors by providing choices. Discuss the concept of agency and its role in the recovery process. Emphasize the value of offering survivors choices in their care, acknowledging their preferences, and involving them in decision-making. Provide examples of how to offer choices in various aspects of support, such as therapeutic interventions, case management, and daily activities. Foster collaboration among team members and with external partners. Discuss the multidisciplinary nature of trauma-informed care and the importance of collaboration among team members from different disciplines. Explore the benefits of coordinating services with external partners, such as legal services and community organizations. Provide guidance on effective communication and collaboration strategies, including regular team meetings, case conferences, and information sharing within legal and ethical boundaries. Cultural competence and sensitivity. Emphasize the need for cultural competence in trauma-informed care, recognizing and respecting diverse cultural backgrounds. Discuss how cultural factors may influence survivors' perceptions of safety, trust, and choice. Provide examples of culturally sensitive practices, such as using interpreters, adapting interventions to cultural preferences, and understanding the impact of cultural trauma. Trauma-informed language. Explore the power of language in shaping the survivor experience. Discuss the importance of using trauma-informed language that avoids blame, shame, and stigmatization. Provide guidelines on communication that promotes empowerment, validation, and dignity. Trauma-informed communication. Develop effective communication strategies that are sensitive to trauma survivors. Practice active listening and validate survivors' experiences. Recognize triggers and responses. Identify common triggers for trauma survivors. Understand potential responses to triggers and how to respond in a supportive manner. Effective communication strategies. Introduce the importance of nonverbal communication, including body language and tone of voice. Discuss the impact of trauma on survivors' ability to trust and engage in communication. Provide guidelines for clear and transparent communication that fosters a sense of safety and trust. Explore the use of trauma-informed language, avoiding triggering or re-traumatizing language. Empathy and compassion in communication. Emphasize the role of empathy and compassion in creating a supportive communication environment. Discuss the power of validating survivors' feelings and experiences. Provide practical examples of empathetic communication, including acknowledging emotions, expressing understanding, and demonstrating genuine concern. Active listening techniques. Define active listening and its significance in trauma-informed care. Introduce active listening techniques, such as paraphrasing, reflecting, and summarizing. Emphasize the value of listening without judgment and creating a space for survivors to share their experiences. Practice active listening skills through role-playing exercises and scenarios. Nonverbal communication. Explore the impact of nonverbal cues on survivor communication. Discuss how body language, facial expressions, and gestures can convey safety or trigger distress. Provide guidance on maintaining open and non-threatening body language during interactions. Communication challenges and solutions. Address common challenges in communication with trauma survivors, such as dissociation, difficulty expressing emotions, or fear of disclosure. Provide practical solutions and strategies for overcoming communication barriers. Highlight the importance of patience and persistence in establishing effective communication. Recognizing triggers and responses. Provide a list of potential triggers, including sensory triggers, e.g., certain smells or sounds, situational triggers, and interpersonal triggers. Discuss how past traumatic experiences can influence current triggers. Emphasize the variability of triggers among individuals and the need for personalized awareness. Understanding potential responses to triggers. Explore the range of responses survivors may have when triggered, including emotional, physical, and behavioral reactions. Discuss the concept of fight-flight-freeze responses and how they relate to trauma triggers. Highlight the importance of avoiding re-traumatization and further distress during triggering situations. Trauma-informed responses. Provide guidelines for responding to survivors in a trauma-informed manner during trigger incidents. Discuss the importance of remaining calm, non-judgmental, and empathetic. Introduce grounding techniques that can help survivors regain a sense of safety and control. Creating trigger plans. Discuss the concept of trigger plans, which involve collaboratively identifying triggers and developing coping strategies. Encourage team members to work with survivors to create individualized trigger plans. Highlight the role of trigger plans in empowering survivors to actively participate in their healing process. Role-playing scenarios. Engage team members in role-playing exercises that simulate real-life situations involving triggers. Encourage the application of trauma-informed communication skills and responses. Facilitate group discussions after role-playing to debrief and share insights. Building resilience in survivors. Explore strategies for promoting resilience and recovery. Highlight success stories and positive outcomes to inspire hope. Understanding resilience. Define resilience as the ability to bounce back from adversity and grow despite facing challenges. Discuss the dynamic nature of resilience and how it can be developed and strengthened over time. Explore the role of external factors, internal strengths, and support systems in fostering resilience. Trauma-informed approaches to promote resilience. Introduce trauma-informed strategies for promoting resilience, recognizing that each survivor's journey is unique. Discuss the importance of creating a safe and supportive environment as a foundation for resilience building. Highlight trauma-specific interventions, such as trauma-focused therapy, cognitive behavioral therapy, and narrative therapy. Strengths-based approaches. Encourage a strengths-based perspective when working with survivors, focusing on their inherent strengths and abilities. Discuss the empowerment derived from recognizing and building upon survivors' resilience. Provide examples of how strengths-based language and interventions contribute to a positive and hopeful therapeutic relationship. Coping mechanisms and adaptive strategies. Explore healthy coping mechanisms and adaptive strategies survivors can employ during their recovery journey. Discuss the importance of helping survivors identify and develop positive coping mechanisms. Encourage the exploration of creative outlets, mindfulness practices, and self-expression as tools for coping and resilience. Social support networks. Emphasize the role of social support in promoting resilience. Discuss the significance of healthy relationships with family, friends, and community in the recovery process. Explore ways to strengthen survivors' social connections and build a supportive network. Promoting self-efficacy and empowerment. Discuss the concept of self-efficacy and its role in fostering resilience. Explore interventions that promote survivors' sense of control, autonomy, and empowerment. Highlight the importance of collaborative goal setting and celebrating small victories. Highlight success stories and positive outcomes to inspire hope. Provide anonymized narratives of individuals who have successfully navigated the challenges of recovery. Highlight key factors and interventions that contributed to their resilience and positive outcomes. Emphasize the diversity of pathways to recovery, reinforcing the idea that there is no one-size-fits-all approach. Guest speakers and survivor testimonials. Invite guest speakers, including survivors who have reclaimed their lives, to share their experiences. Incorporate survivor testimonials, either through video or in-person presentations, to provide first-hand perspectives on resilience and recovery. Allow for a Q&A session to facilitate direct interaction between survivors and team members. Showcasing progress and milestones. Highlight the importance of acknowledging and celebrating survivors' progress and milestones. Showcase examples of positive changes, personal growth, and achievements that signify resilience. Emphasize the role of a trauma-informed approach in fostering an environment where success is recognized and celebrated. Visualizing future possibilities. Encourage team members to help survivors visualize and articulate their goals for the future. Discuss the power of positive thinking in the recovery process. Use visualization exercises or vision boards to help survivors create a tangible representation of their aspirations. Self-care for professionals. Emphasize the importance of self-care. Provide tools and resources for managing vicarious trauma and burnout. Understanding the impact of trauma work. Discuss the concept of vicarious trauma and burnout in the context of trauma work. Highlight the emotional and psychological toll that continuous exposure to trauma narratives can have on professionals. Emphasize that self-care is not just a luxury but a critical component of maintaining resilience and effectiveness in their roles. Impact on professional effectiveness. Discuss the correlation between self-care and professional effectiveness. Emphasize that practicing self-care enables team members to better support survivors and contribute to a positive workplace culture. Provide evidence-based insights on how self-care positively influences job satisfaction and prevents burnout. Identifying signs of vicarious trauma and burnout. Provide a list of common symptoms associated with vicarious trauma and burnout, such as emotional exhaustion, depersonalization, and decreased job satisfaction. Encourage regular self-reflection to monitor personal well-being and identify potential warning signs. Individualized self-care plans. Guide team members in developing personalized self-care plans that align with their individual needs and preferences. Discuss different dimensions of self-care, including physical, emotional, social, and spiritual aspects. Emphasize the importance of self-care plans being realistic, achievable, and sustainable. Mindfulness and stress reduction techniques. Introduce mindfulness and stress reduction techniques as effective tools for managing vicarious trauma. Provide practical exercises, such as deep breathing, meditation, or progressive muscle relaxation, that can be easily incorporated into daily routines. Discuss the benefits of incorporating mindfulness practices in promoting resilience and reducing stress. Professional supervision and peer support. Emphasize the value of regular supervision for processing challenging cases and emotions. Encourage team members to seek professional supervision as needed. Highlight the benefits of peer support groups, where team members can share experiences and strategies for coping with vicarious trauma. Continuous training and education. Highlight the importance of continuous training and education on self-care practices. Integrate self-care discussions into regular team meetings and training sessions. Provide resources for ongoing learning and staying updated on best practices in the field. Encourage participation in relevant workshops, conferences, and webinars. Monitoring and evaluation. Discuss the importance of regularly monitoring and evaluating trauma-informed practices. Encourage team members to provide feedback on the training. Highlight the use of feedback mechanisms, performance evaluations, and self-assessment tools. Emphasize the role of reflective practice in identifying areas for improvement and celebrating successes. Tailor the training to your team's and survivors' specific needs and context. Enhance engagement by incorporating interactive elements. Adapt these suggestions to your target group or country, considering cultural changes and sensibilities. Thank you for viewing this trauma-informed care training guidance presentation. Please disseminate this training guidance to various agencies and humanitarian projects dedicated to serving individuals and enhancing their well-being. Sharing this resource will contribute to the collective effort in improving the support provided to those in need.